Welcome to our presentation on the 15 symptoms and signs of prostate cancer by Dr. Adedeloye. This guide is designed for both patients and healthcare providers for educational purposes only. Prostate cancer is the most common non-skin cancer in men, and it's a serious issue. In the U.S., over 270,000 new cases are diagnosed each year, especially after age 50. Some cases are slow-growing, but others can be aggressive and life-threatening. Recognizing symptoms early is crucial. Look out for urinary issues, bone pain, or neurological changes. Understanding these signs helps patients seek care and doctors provide timely treatment. Together, we can improve outcomes and fight this disease. Symptoms of prostate cancer can be categorized into 4 groups: local urinary symptoms, ejaculatory and sexual dysfunction, pelvic and regional symptoms, and systemic symptoms. Recognizing these can aid in early diagnosis and management. Let's begin our discussion with urinary symptoms. Local genitourinary symptoms in prostate cancer often stem from the tumor's location around the urethra and bladder neck. As the cancer grows, it can obstruct urinary flow, leading to increased frequency, especially at night. Hello, nocturia. Patients may experience urgency, hesitancy, and a weak or interrupted stream. Starting or stopping urination can become a challenge, along with a feeling of incomplete emptying. Some may even face painful urination, known as dysuria. In early stages, these symptoms can be subtle and mimic benign prostatic hyperplasia, or BPH. If the tumor invades blood vessels, hematuria may occur, indicating more advanced involvement. Now, let's dive deeper into each symptom. Frequent urination, especially at night, is a common symptom. Tumor growth can obstruct the prostatic urethra, reducing bladder capacity. This symptom is often one of the earliest indicators and can mimic benign prostatic hyperplasia. A weak or interrupted urine stream results from the narrowing of the urethra due to tumor compression. This symptom is prevalent in both benign prostatic hyperplasia and prostate cancer, necessitating further evaluation. Difficulty starting or stopping urination occurs when bladder outflow is obstructed. This affects the coordination of urinary sphincter and detrusor contraction, leading to hesitancy and dribbling. The urge to urinate is caused by bladder wall irritation from partial obstruction. This increases sensitivity and overactivity of the detrusor muscle, often confused with urinary tract infections in older men. Incomplete bladder emptying is due to tumor mass obstructing the urethra, preventing full evacuation. This increases the risk for urinary tract infections and bladder stones. Painful or burning sensation during urination, known as dysuria, results from tumor-induced inflammation or secondary infection. This symptom is unusual in early-stage prostate cancer unless there is extensive local invasion. Hematuria, or blood in urine, is a red flag symptom. It occurs due to neovascularization or direct tumor invasion into blood vessels. This mandates a thorough urological workup, including cystoscopy and imaging. Next, we will look at ejaculatory and sexual dysfunction symptoms. Ejaculatory and sexual dysfunction can be alarming, especially for men facing prostate cancer. These symptoms often stem from the tumor's invasion of structures vital for sexual function. Patients may experience painful ejaculation, blood in semen, and erectile dysfunction. These issues can arise from nerve involvement or the psychological toll of a cancer diagnosis. It's crucial to recognize these symptoms as potential indicators of underlying malignancy. They can significantly impact quality of life and are often misattributed to aging. If you're experiencing these symptoms, especially with elevated PSA levels, don't ignore them. Let's explore each symptom in detail. Erectile dysfunction can result from tumor infiltration into neurovascular bundles, disrupting parasympathetic innervation essential for erection. Psychological stress or treatment-related factors may exacerbate this condition. Painful ejaculation is often underreported, but significant in quality-of-life assessments. Tumor involvement of seminal vesicles or ejaculatory ducts triggers discomfort during seminal emission. Hematospermia, or blood in semen, is often benign but concerning in men over 40. Tumor disruption of small blood vessels leads to this symptom, warranting evaluation for malignancy, infection, or inflammation. Now let us take a dive into pelvic, bone, and systemic symptoms. Pelvic, bone, and systemic symptoms in prostate cancer can signal advanced disease. Discomfort or pressure may arise from tumor expansion, compressing nearby structures like the rectum or pelvic nerves. As the cancer spreads, bone pain, especially in the spine, hips, and pelvis, becomes a key sign of metastases. These bone lesions can lead to tenderness, fractures, or even spinal cord compression with neurological issues. Leg swelling or lymphedema may occur due to lymphatic obstruction from nodal metastasis or venous compression. Systemically, patients might face weight loss, fatigue, and anemia, reflecting cancer-related cachexia and inflammation. These symptoms not only indicate disease progression, but also impact prognosis and functional status, highlighting the need for prompt recognition and multidisciplinary care. Now, let's explore each symptom in detail. Discomfort or pain in the pelvic area may occur due to local tumor expansion compressing adjacent structures. This symptom is nonspecific but important, especially if progressive or associated with defecatory symptoms. Swelling in the legs can result from lymphatic obstruction due to metastatic spread. This may mimic deep vein thrombosis, and Doppler studies or imaging can help differentiate the causes. Bone pain, tenderness, or fractures, especially in the back, hips, or thighs, indicate advanced disease. Prostate cancer has a predilection for osteoblastic metastases, leading to compromised structural integrity and pathologic fractures. Neurologic symptoms, if the spine is involved, are a medical emergency. Vertebral metastases may compress the spinal cord, leading to weakness, sensory deficits, or incontinence. Urgent MRI and specialist input are required. Systemic symptoms like fatigue, loss of appetite, weight loss, and anemia are multifactorial. They significantly impact quality of life and may require multidisciplinary management to address the underlying causes. This table summarizes the signs and symptoms of prostate cancer and their causes. Understanding these can aid in early detection and appropriate management, improving patient outcomes. If any of these signs and symptoms are discovered, the next steps include consulting a healthcare provider, undergoing prostate-specific antigen or PSA testing, imaging or biopsy for diagnosis and treatment planning. Diagnosing prostate cancer starts with a clinical evaluation and PSA testing. A digital rectal exam may help identify any suspicious findings. If something's off, we move to multi-parametric MRI and a biopsy to confirm the diagnosis. This also helps determine the Gleason score and tumor grade. Staging involves imaging like bone scans or CT to check for spread. Management varies from active surveillance for low-risk cases to surgery or radiation for advanced disease. A multidisciplinary approach ensures personalized care, balancing treatment with quality of life.